One of the main reasons I went into this specialty is a little selfish. I do have allergies and asthma myself. So I've always wanted to learn more about the disease process. And I can also understand what patients go through when they tell me, you know, I can't breathe, my chest is tight, my nose is stuffy, you know, my skin is itchy. I've had a lot of these symptoms, so I know what they're talking about. The reason I am here as opposed to a traditional allergy office, which I've been in before, is because here we're allowed to think out of the box and we treat the whole allergen load as opposed to little pieces of, you know, the nasal symptoms, and then when that is not quite under control, then we add something else, or if the asthma is not quite under control, you add something else. And the other thing that I can do here, and I was never able to do before, is treat food allergies with immunotherapy, which nobody else can really do. My treatment philosophy is possibly use as little medication as possible if you can. What happens initially, it looks like we have to use a lot of medication to get people under control. Once they're under control and everything kind of cruises along, then I like to cut down on medication and eventually take people off if we can. The nice thing about allergy and immunology is that we can do disease-modifying treatments like immunotherapy, which is not medication. And the longer people are on immunotherapy, usually the less medication they need, both for the nasal symptoms, the lung symptoms, the skin symptoms, gut symptoms. I like the patients who have asthma and eczema and hives and complicated. And then you start treating them and putting everything, all the pieces together, and they finally get better. That's the best.
Allergy associates of the Crosse Allergy Solution.